Now that was unexpected. What we saw was a percentage of people affected by COVID according to that individual state's population. Now, Dr. Sucharita, what do you think about this bar chart video?
The data represented in this bar chart is actually called prevalence. For example, if a state has 3,000 cases of COVID reported and another state has 4,000 cases of COVID reported, according to you, which state has worst performance or worst reported cases?
If it is such a blunt question, I would say it is the state with 4,000.
So let us add a little bit more information and look into this. If the 3,000 cases are reported against a population of 10,000, here the prevalence will work out to be
30%.
Yes. And the 4,000 cases are reported against a population of 1 lakh, the prevalence will work out to be
4%.
So when you look at this way, which state is having lower prevalence?
Prevalence would be the one with 4,000 cases, but with a population of 1 lakh, so 4% prevalence.
So the viewers can easily understand that the total number of cases is not actually the indicator for us to assess the disease burden of COVID cases in a state. Rather, prevalence would be the better indicator.
Okay. So now that's why we had all these surprising elements in this bar chart video. So when we see the top 5 states, the top 5 were Goa, Ladakh, Goa, Delhi, Ladakh, Kerala and Puducherry. Now Goa, Ladakh and Puducherry all have a lower number of population when we compare it to Delhi or Kerala. Goa's population being 15 lakhs, Ladakh having just 2.8 lakhs and Puducherry having about 14 lakh population. When we compare that to Delhi's population, which is about 1.8 crores, or Kerala's population, which is about 3.5 crores, I think we can get a picture on why these low population states come out on top, right?
Yes. Interestingly, you can also see that the central India, especially the states like Bihar, Uttar Pradesh and Madhya Pradesh, have highest population among other states comparable in the country. But if you look at the number of cases reported here, against the population, Bihar has a population of 12.4 crores and Uttar Pradesh is one of the highest populated in the country with 23.7 crores and Madhya Pradesh also has 8.5 crores. But if you look against the infections which are reported here, can I just have it? It shows like they have some of the lowest numbers of COVID cases. And this is where the surprises are forever revealed in this kind of data you have projected.
So that is why these states come at the bottommost of this list, Bihar, UP and Madhya Pradesh. Now, but this is exactly what is not being done in the media. Our media just focuses on total number of cases. They don't take into account the percentage. It's more of a cringe media, which is just obsessed and criticizing rather than actual analysis of data. Now, if we want to make this data a bit more accurate, or if we want to have data which helps us understanding this disease a bit further, what do you think would be more appropriate?
To be honest, we can get age-wise distribution and also gender-wise distribution. The rural-urban divide, especially the data relevant to rural segments and urban segments, and also the hotspots. If we can get data related to these dynamics, we will be able to appreciate in-depth understanding of the disease.